Today, we're going to discuss a sensitive but crucial topic, some common types of medications that, for certain individuals or under specific circumstances, might be associated with an increased risk of cardiovascular events, like a heart attack. Hello, and a warm welcome back to Senior Wellness. I am Lexi, Senior Health Specialist, your guide to navigating our senior years with health awareness and vitality. It's wonderful to have you tuning in today. We often rely on medications to manage health conditions and improve our quality of life. They are essential tools. However, it's also incredibly important to be informed consumers of our own healthcare. Today, we're going to discuss a sensitive but crucial topic. Some common types of medications that for certain individuals or under specific circumstances might be associated with an increased risk of cardiovascular events, like a heart attack. Now, let me be very clear right from the start. This discussion is for awareness and information only. It is not a suggestion to stop taking any medication prescribed by your doctor. Doing so can be very dangerous. The goal today is to empower you with knowledge so you can have informed conversations with your healthcare providers about your specific situation and medication plan. If you find this information valuable, please consider giving this video a like. It helps others in our community find it. And if you haven't already, please subscribe and click the notification bell for more insights into healthy aging. We always appreciate your comments and questions below. All right, let's gently explore this important subject together. Understanding medication risks, a balanced view. Every medication, whether prescription or over-the-counter, comes with potential benefits and potential risks. Doctors weigh these carefully when prescribing treatment. For seniors, this balance can sometimes be more complex due to factors like having multiple health conditions or taking several medications concurrently, polypharmacy. Being aware of potential risks allows you to be a more active participant in your healthcare discussions. Let's look at 5 categories of medications where awareness of potential cardiovascular effects is beneficial. Certain hormonal treatments, historically including contraceptives. The original source material included hormonal contraceptives. While these are primarily used by younger women, it's worth briefly acknowledging that hormones, particularly estrogen, can influence the body's clotting mechanisms. Relevance for seniors. Most women in the 60-plus age group are not using hormonal contraceptives. However, some may be using or have used hormone replacement therapy, HRT, post-menopause. The risks and benefits of HRT are complex and highly individual, depending on the type, dose, duration of use, and personal health history. While different from contraceptives, the general principle that hormones can impact cardiovascular risk is relevant. Key takeaway. Discussions about any hormone therapy should always involve a thorough review of personal cardiovascular risk factors with your doctor. This category is less directly applicable to most seniors than the following ones, but good general knowledge to possess. Non-steroidal anti-inflammatory drugs, NSAIDs. This is a very common category of medication used for pain, inflammation, and fever. Many are available over-the-counter. Examples: ibuprofen, Advil, Motrin, Naproxen, Aleve, diclofenac, prescription, celecoxib, Celebrex, a specific type called COX-2 inhibitor. How they work. Simplified. They block enzymes, COX-1 and COX-2, involved in inflammation and pain signaling. The potential risk. By blocking these enzymes, NSAIDs can sometimes disrupt the natural balance that regulates blood vessel function and platelet activity. This can potentially lead to increased blood pressure and a higher risk of blood clots, which may increase the risk of heart attack or stroke. Important notes. The risk exists even with short-term use and can increase with longer use and higher doses. This applies to both over-the-counter and prescription NSAIDs, except potentially low-dose aspirin used specifically for heart protection under doctor's advice. The level of risk can vary between different NSAIDs, e.g., diclofenac is often cited as having a higher risk. Individuals with existing heart disease or risk factors, like high blood pressure, are generally at greater risk. Actionable advice for seniors. Use the lowest effective dose for the shortest possible time. If you need long-term pain relief, especially for conditions like arthritis, discuss the risks and benefits of NSAIDs versus other pain management strategies like acetaminophen, physical therapy, topical treatments with your doctor. Be sure your doctor is aware if you frequently use OTC NSAIDs, T1. Certain diabetes medications, thiazolidinediones, TZDs. This class of medications is used to treat type 2 diabetes by improving the body's sensitivity to insulin. Examples: rosiglitazone, Avandia, pioglitazone, Actos. Note, rosiglitazone is used much less frequently now due to safety concerns. The potential risk. Extensive research and debate have focused on the cardiovascular safety of this class. While some initial concerns about heart attack risk with rosiglitazone were debated, a more consistent finding across studies for this class of drugs is an increased risk of heart failure. This is often linked to fluid retention, which can be a side effect. Current status. Due to these concerns, particularly with rosiglitazone, the use of TZDs has decreased, and other classes of diabetes medications with more favorable cardiovascular profiles are often preferred, especially for patients with existing heart disease or heart failure risk. Actionable advice for seniors. If you are taking a medication in this class, pioglitazone is more common now, ensure your doctor regularly monitors your heart health, including checking for signs of fluid retention, like swelling in the legs or ankles, sudden weight gain, shortness of breath. Discuss your overall cardiovascular risk profile and whether this medication remains the best choice for you compared to newer alternatives. Certain antidepressants, TCAs, and some SSRIs. Antidepressants are vital for treating depression and other conditions, but some types can have effects on the heart. Tricyclic antidepressants, TCAs. Examples include amitriptyline, nortriptyline. Potential effects. TCAs can sometimes affect the heart's electrical conduction system, potentially causing changes seen on an ECG, increase heart rate, and cause orthostatic hypertension, a sharp drop in blood pressure upon standing, leading to dizziness and increasing fall risk. A significant concern for seniors. Due to these effects, they are often used with more caution in individuals with pre-existing heart conditions. Selective serotonin reuptake inhibitors, SSRIs. Examples include fluoxetine, Prozac, sertraline, Zoloft, citalopram, Celexa, escitalopram, Lexapro. Potential effects. Generally considered to have a safer cardiovascular profile than TCAs. However, some SSRIs, notably citalopram and escitalopram, can potentially affect the heart's electrical rhythm, specifically prolonging the QT interval, especially at higher doses. This can increase the risk, albeit low, of a serious arrhythmia. Doctors are mindful of dosage limits for these specific medications. SSRIs can occasionally cause dizziness or slower heart rate in some individuals. Actionable advice for seniors. Mental health is crucial, and antidepressants are important treatments. Never stop taking an antidepressant abruptly. Always discuss your heart health history with your doctor when starting or changing these medications. Be aware of potential side effects like dizziness or palpitations and report them to your doctor. Understand that your doctor considers these potential risks when choosing the best medication and dose for you. Pseudoephedrine, common decongestant. This ingredient is found in many over-the-counter cold, allergy, and sinus medications, often kept behind the pharmacy counter. How it works: it constricts blood vessels, primarily in the nasal passages, to reduce swelling and congestion. The potential risk: this blood vessel constriction isn't limited to the nose. It can occur throughout the body. This can lead to an increase in blood pressure and heart rate. In susceptible individuals, especially those with existing high blood pressure, heart disease, or arrhythmias, this can potentially strain the heart, increase oxygen demand, and, in rare cases, trigger cardiac events or arrhythmias. Actionable advice for seniors: use medications containing pseudoephedrine with caution, particularly if you have high blood pressure, heart rhythm problems, or other cardiovascular conditions. Always check labels. Consult your doctor or pharmacist before using these products to see if they are appropriate for you or if safer alternatives exist, like saline nasal sprays or certain antihistamines. Monitor your blood pressure if you do use them. Your role: informed partnership with your doctor. Seeing this list might feel concerning, but remember, the purpose is awareness, not alarm. Talk to your doctor/pharmacist. This is the most important step. Discuss all medications you take, prescription, OTC, supplements, and your full health history. Ask specific questions about how your medications might affect your heart health. Don't stop medications. Never stop taking a prescribed medication without consulting your doctor. The risks of stopping abruptly often outweigh the potential risks discussed here. Know the signs. Be aware of potential symptoms of heart problems: chest pain, discomfort, shortness of breath, unusual fatigue, palpitations, dizziness, swelling, and seek medical attention promptly if they occur. Lifestyle matters. Maintaining a heart-healthy lifestyle, balanced diet, regular appropriate exercise, not smoking, managing stress, helps mitigate overall cardiovascular risk, regardless of medications. Being informed about the potential effects of your medications is a key part of being an active partner in your healthcare. While the medications we discussed today offer important benefits, understanding their potential impact on cardiovascular health allows you to have more meaningful conversations with your doctor and pharmacist. Remember, the goal is always to find the right balance where the benefits of treatment clearly outweigh any potential risks for you as an individual. Never hesitate to ask questions and advocate for your health. Thank you so much for joining me today on Senior Wellness. I hope this discussion has been helpful and empowering. If you found this information valuable, please give it a like, share it with anyone who might benefit, and leave your thoughts or questions in the comments below. And please, don't forget to subscribe and hit the notification bell to stay connected with Senior Wellness for more insights into healthy, vibrant aging. Stay informed, stay proactive, and take wonderful care of your heart and overall health. We'll see you in the next video.